Welcome, everyone. Welcome to our event this evening, The Public Health Threat of Policing and Mass Incarceration, with Zach Norris of the Ella Baker Center and Dr. Jennifer James of the University of California, San Francisco. We welcome you to post in the chat where you're zooming in from and a little bit about yourself. Are you a health professional, a student, a researcher, an activist, or just someone who's passionate about public health? Before we start, just another reminder, we are recording this evening's session. Also, we want to take a moment to acknowledge that SF Bay PSR is located on the unceded and ancestral homeland of the Ramaytush and Ohlone peoples who inhabited the San Francisco Bay Peninsula, are the original inhabitants of the San Francisco Bay Peninsula. And I'd like to tell you a little bit about San Francisco Bay PSR. SF Bay PSR organizes physicians and other health professionals to defend health and demand racial, social, and environmental justice by combining the power of community activism and the knowledge of credibility of health professionals. We promote public policies and support our intertwined areas of concentration: environmental health and the climate crisis, nuclear weapons abolition and the end to the arms race, social and racial injustices, and the health burdens of vulnerable communities, and the education of the public and our future health professionals. Our 2021 event series focused primarily on the connections between climate change, systemic racism, health inequities, and nuclear issues. Please join us on June 23rd for Decarbonizing Finance, Beyond Divestment and Investment, on June 30th for our almost monthly racial equity reading group, and save the date, September 22nd, we will be hosting our annual gala with keynote speaker Daniel Ellsberg. To learn more about our events, issues, policies, projects, how you can take action and donate, please visit our website at sfbaypsr.org. You can also find reading lists for all our events on our website, including a reading list for tonight so that you can deepen your knowledge. Also, please sign up for our newsletter, like us on Facebook, and follow us on Instagram and YouTube and Twitter. As you listen to the speakers, please post your questions in the chat or hold them until the Q&A session. During the Q&A, we invite you to show your video and join the discussion. We very much hope that this event will be an opportunity to build community and get to know each other. Now, I'd like to take a moment to pause. We would like to take a moment of silence to remember George Floyd, who was murdered a year ago yesterday. We also would like to honor all the sons, daughters, brothers, and sisters who've been killed by the police in recent years. We are grateful to Their Names Project for providing a slide with the names of thousands of people who've been killed. Please read the names as we take a moment to pause. Tara is queuing up the slide. It may take just a second or two. Thank you. Tonight's event is hosted by two of our SFBA board members who are championing, our racial equity work. Doctors Aude Boignon and Jeff Ritterman. Aude, I hand it over to you.
Thank you so much, Julia. Thank you all for joining us tonight. As Julie mentioned, tonight's event is entitled Public Health Threat of Policing and Mass Incarceration. And as Julie mentioned, my name is Aude Boignon, and I'm a neuroscience at UCSF and also a second-year medical student and recent board member of PSI. In 2020, an average of 3 people were killed by the police every day of the year. The highly respected medical journals, The Lancet and the CDC, both state that racism is a serious threat to public health. As healthcare professionals, we know that an ounce of prevention is worth a pound of cure. We need to direct more funds and efforts towards improving prevention systems, supporting community, and advancing anti-racism efforts and away from policing and incarceration. Policing is supposed to protect, not threaten lives, and yet Black people are killed by police at 2.6 times the rate of white people. The constant stress and fear this causes, as well as the trauma every time another person of color is killed, creates long-term health harms. Mass incarceration adds this burden by harming more than rehabilitating. We must reimagine and reform our social systems such that they protect health. Tonight, we will explore these issues and much more with expert guest speakers, Zach Norris, the Executive Director of the Ella Baker Center, and Dr. Jennifer James, bioethics researcher, professor, and Black feminist scholar at UCSF. Super excited to kick off this event. Jeff, I'll hand it off to you.
Well, I'm very excited to be able to introduce Zach Norris. When Physicians for Social Responsibility first decided on putting together a webinar on the public health threat of policing and mass incarceration, I immediately thought of Zach Norris as one of our speakers. I had had the opportunity to hear Zach speak, and I had the opportunity to read his book, Defund Fear, and I was so impressed by his wisdom, brilliance really, that I thought we should allow everyone in our community to also benefit from hearing from Zach. But it's not really just what he says or what he writes in his books. Zach is a social activist, and he is a national leader in restorative justice. And it's really because of his work that a whole number of youth incarceration prisons in California have closed. And none of those institutions, none of those youth prisons were rehabilitative. Nobody went into those prisons and came out better than they went in. And they were really centers for harm. And as physicians, our first credo is do no harm. And you can really think of Zach as a physician for the body politic. And these days, not only are we looking for knowledge, we're looking for inspiration. And Zach is the kind of person who can inspire us, because we're really called upon to do more than we've ever been called upon before. Zach is a loving husband and dedicated father to 2 bright girls. He is a lawyer, an author, social activist, and executive director of the Ella Baker Center for Human Rights. As I mentioned, he is a national leader in the restorative justice movement. And the goal of that is really to shift economic resources away from prisons and punishment and toward economic opportunity. He is the co-founder of Restore Oakland and Justice for Families, both of which focus on the power of community action. Zach graduated from Harvard. He got his law degree at New York University, And the premise of his book, Defund Fear, is that we are safer together when we shift the conversation about public safety away from fear and away from punishment and toward growth and support systems for our families and communities. As we build public safety systems that recognize our connection to each other, we also give ourselves our best chance to rescue democracy. And this is, at this moment, really what we're being called upon to do in this country, to rescue democracy. I don't think in my lifetime it's ever been threatened as more as it has been now. It's really an honor and a pleasure for us to welcome Zach to Physician's Responsibility and to have him address us on the public health threat of policing and mass incarceration. Thank you for accepting our invitation, Zach, and welcome to our webinar.
Thank you so much, Jeff. I greatly appreciate that kind introduction. I hope that I can be inspiring today. I should be inspired today. My daughter was promoted. We won't call it a graduation. She went from 5th grade to 6th grade, but there was some celebration. And she asked me if I was going to give her a gift. I said, well, it's not legally, it's legally mandated that you continue your school at this age, but her grandmother got her a gift. So it all worked out. I think that's what grandmothers are for. And, you know, I think I have to be honest that during the ceremony, I felt as much relief as I did sort of jubilation for her, because it's been a hard year. It's been a challenging year for all of us in ways that are big and small, in ways that are often catastrophic. And I just really want to name something that I heard in the introduction. One is that we started with this naming of the lands that we are on, and then we moved to naming and honoring the lives of people who have lost their lives to police violence. And I believe that there is, in fact, a connection between those phenomenon that we don't often enough acknowledge. And I share this slide to talk about our history, because it's one thing to name and acknowledge the lands that we live on. I think it's another thing to name and acknowledge that we are living in a society in a state that was built upon the genocide of Native Americans. And we had presidents who said things like this at the top. We have leaders more recently who have said that, you know, I don't want to abolish government. I simply want to reduce it to the size where I can drag it into the bathroom and drown it in the bathtub. And I think over the past 400/40 years, we've had a motto of the ideology of that the only good government is a death government. And my belief is that the leadership of folks like Ella Baker can move us to a different dynamic and a different state of being where each and every one of us are valued. Ella Baker believed in the power of everyday people to make change. And as the executive director of the Ella Baker Center, I try to help our whole team and staff and members build upon that legacy by advancing what we call a books, not bars, jobs, not jails, healthcare and housing, not handcuffs agenda. Because for us, we know that the vision that has been put forward about what keeps us safe is actually a lie. And we have a specific name for it. We call it the "he keeps us safe" lie. And it is, to Jeff's point, the lie of dictators. Because what do dictators do? They say, don't trust anybody but me, right? I am the foundation of safety. Only trust my word. And that lie is an abusive lie. It's the same lie that abusers in homes tell when they say, don't trust your girlfriend, don't trust your mom, only trust me, even as they are causing the harm in the home. And so we had a president for 4 years who put forward that lie. He said, don't trust your neighbors at the border, don't trust your neighbors in distant lands, don't trust your neighbors around the block, only trust me, even as he was hiding the harms right in our home country, right here in the United States. And so what we need is a real paradigm shift in terms of how we think about safety that isn't necessarily about inventing something new, but really honoring what we know. Because if I asked you to think of a time when you felt safe, and I'll ask you to just reflect on that for a second, just think of a time when you felt truly safe. I think about my grandmother, who passed this year. And I think about how she held my hands. She had this way of holding my hands that was like a 2-hand hold. It wasn't just one hand, it was 2 hands. And one hand was just kind of patting my little hand in hers. And it was this beautiful reminder that she had my back. And she had my back, not just when I did well, but also when I made mistakes. And I think we've grown accustomed to the idea that being held accountable is about punishment, it's about fear, it's about hurting someone. But real accountability is actually about being held, right? It's about being held accountable. And my argument to you is that we can't hold anyone accountable if we don't hold them in community. And over the past 40 years, what we have invested in is this ideology of a death governance, where the same things that accelerate morbidity and mortality, not just here in the United States, but also abroad, are the things that are funded year after year, whether it be recession, boom, or bust cycle. So 53 cents of every federal dollar goes to the military. We know that in California, policing, what we spend on policing has skyrocketed from 1980 to 2016. During that same time period in California, we built 23 new prisons and just 1 new university. And in many ways, we got what we paid for. In municipalities like Ferguson, which in many ways was one of the sparks, the murder in Ferguson was not just about the loss of one individual life, as this statistic shows, but really was about an underlying reality where the police saw Black folks as basically the cash cow for that municipality. 88% of police use of force against Black folks, 16,000 people with outstanding warrants, and literally the city officials talking about the need to increase revenue by increasing the arrests of Black and brown people. And so this is a reality that we can change. It is a reality that must change. And it is a reality that fortunately has been changing. And what I want to lift up is that it's partly changing because we've come to understand new realities, that the way we treat people and the way we treat the planet is indicative and important in terms of every single one of us. So if we have 4% of the world's population and 25% of the world's prisoners and carbon emissions, we shouldn't be surprised then that we also had 25% of the world's COVID deaths. And so that reality is something that we've come to grapple with and had to grapple with in a different way in the context of COVID-19. And I think it's shown something that for me was for a time puzzling, which is why do we have decreasing crime rates, but increasing anxiety? Decreasing crime over the past 30 years but actually increasing anxieties. And that's partly because there is a larger suite of harms and a smaller suite of crimes that are being dealt with. And those larger suite of harms, from climate change to inequality, are too often swept under the rug by our elected officials in ways that I have described. And those same folks are then pointing back to scapegoated communities, be they, you could just look at the track record of Donald Trump alone and look at how he scapegoated Latinx communities, Black communities, and then Asian communities with COVID-19. And so all of that scapegoating, none of it leads to greater safety or security for our community. But as Jeff mentioned, we can actually move in a different direction at the Ella Baker Center to begin to flip the script in terms of how young people and adults are seen by these systems, and to be able to begin to actually shut down youth prisons and move resources back into communities to resource the kind of community safety solutions that actually work. And so when we started that work, I started at the Ella Baker Center as fresh out of law school with the charge of organizing families of incarcerated youth, and sat around a table with a number of families who said, we don't want to just change these youth prisons, we actually want to shut them down. And what we began to do is organize. We began to go to the Capitol and talk with legislators about how families were driving hours just to see their loved ones, being denied visits because they had on the wrong color pair of pants, that their children and grandchildren were on lockdown for 23 hours a day for sometimes months on end. And what we were able to do was put to bed this mythology of the welfare queen, of the youth super predator, and really get legislators to remember families, to remember that Black families are intact, that they are whole, that they are not broken, that they are resilient, and to challenge some of these age-old stereotypes that isolates individuals from their families. And as we did that, we started to change legislator by legislator's mind. We stopped getting doors slammed in our faces and started getting welcome receptions. And over a near decade-long campaign, we were successful in closing 5 of 8 youth prisons across the state of California. And the governor just last year signed legislation to close the remaining 3 youth prisons. And that is now a huge opportunity to build this vision of truth and reinvestment, to lift up and not be afraid to talk about this long legacy of racial injustice, but also to be able to talk about our vision for the future, which is bright, which is interdependent, and which is based on an understanding that when you incarcerate an individual, you're not just impacting that individual, but their entire family and their community, and that there is a different way forward. And so I'm closing here, we built Restore Oakland with the idea of lifting up a new vision of community safety. Because I know you all are concerned about climate change, as am I. And I believe that just as the climate change movement needed solar panels and wind turbines and permaculture and other visible, tangible, physical examples of what a new energy infrastructure would look like, so too do we need physical, tangible, real examples of what a new safety infrastructure looks like. And so Restore Oakland is housing a dedicated space for restorative justice, is housing a restaurant that'll be run by formerly incarcerated folks and others who have been locked out of opportunity. And it's just one example. It's just one grain of salt of a growing movement of safety solutions that should no longer be seen as the alternatives, but should in fact be seen as the status quo we need to build out to have public safety for all. Because I believe that public safety starts with an investment in public health, investment in a public health infrastructure, so that we no longer are caught flat-footed when something like a quintessential public health disaster like COVID-19 comes along. Instead, we've built out the public health infrastructure to deal with school discipline and mental health and homelessness and all of these issues that we know to be public health issues at root. So thank you so much for your time, and I will stop talking now.
Thank you so much, Zach. That's really amazing. I look forward to discussing more in a little bit. Next, I'd like to introduce Dr. Jennifer James. Dr. James is an assistant professor in the Institute of Health and Aging and the Department of Social and Behavioral Sciences and the Bioethics program at the University of California, San Francisco. Dr. James is a qualitative researcher and Black feminist scholar whose research lies at the intersection of race, gender, and health. Her current work is focused on the experiences of aging, health, and illness for people who are or have been incarcerated. Dr. James will give a very brief introduction of carceral health and healthcare and talk about the current moment of COVID-19 and what it has shown about health and healthcare for those living and working in prisons and jails. We will discuss what roles physicians and other healthcare providers can play and ethical questions surrounding the expansion of healthcare for those who are incarcerated. Dr. James, I'll hand it off to you.
Thank you so much. I'm so excited to be here. It's such an honor to be in conversation with this organization, with Zach. I've been such a longtime admirer of Zach's work, of the Ella Baker Center, of Ella Baker herself. And I too found that so inspiring, the work that is done to help us imagine a new possibility for what our community can look like is so tremendous. So I am going to share my screen. So as Ode mentioned, I wanted to talk a little bit now, sort of diving deeper into some of the questions and topics that Zach presented, and really focus in on what happens inside of prisons in terms of healthcare. And I'm a sociologist, I'm a qualitative researcher. I think my job is that I raise questions. So that's mostly what I'm going to do is raise questions that I'm grappling with. And thinking about with some collaborators and some students, some of whom are on the call today, in the hopes that you all will think about them with me. So I just want to give a really brief history of sort of prisons and medical care inside of prisons. We actually don't know that much about what healthcare looked like in prisons prior to the 1960s. Medical records weren't really kept, but suffice to say, this quote I think is great: substandard at best and appallingly negligent and even brutal at worst. Often the healthcare was being delivered by people who didn't have medical training, including by other people who were incarcerated. And medical experimentation is something that was prevalent across many of prisons and other types of institutions. In the 1970s is when there started to be some shifting on this. So organizations like the American Public Health Association, the American Medical Association started considering carceral health, including in their ethical guidelines or noting it as an area where more attention was needed. And in 1976, there was a Supreme Court decision, Estelle v. Gamble, which established a right to healthcare for people who are incarcerated based in the Eighth Amendment and people's right to be free from cruel and unusual punishment. And that sort of really shifted how we think about prison healthcare and the idea that there had to be healthcare offered inside of prisons. So California specifically, California actually, this is according to the CDCR, California Department of Corrections, had the first prison hospital in the country was in California, established in 1955. And so we've long thought about this as a topic, recognized a need. But unfortunately, that care has not always been sufficient. So after Estelle v. Gamble, it opened up new possibilities for litigation, for noting areas of substandard care and advocating for reforms. So since the 90s and early 2000s, there have been ongoing, intersecting, overlapping legal cases in the state of California. The Plata case, which is about healthcare, the Coleman case is specifically about mental health, and the Armstrong case, which is about disabilities, all of which have been ongoing over the course of decades to today, that are, and I'm going to speak specifically about Plata, is alleging that, California Department of Corrections, their medical services are inadequate, that they violated the 8th Amendment. So all of these are about 8th Amendment, 14th Amendment, Americans with Disabilities Act. So all of these cases had ended up being found that CDCR needed to do better. There have been rulings and procedures put in place for this. And as a result of the Plata case specifically, it was ruled in 2001, CDCR needed to provide better medical care. In 2006, it was determined they are not doing that. And so as a result, the courts found that since care didn't meet federal constitutional standards, California's medical care was placed in a receivership. So the secretary who oversees all of corrections does not oversee healthcare in California prisons. There's a receiver. This is a picture of the receiver, Clark Kelso. And the receivership is responsible for managing all the medical programs and all the costs associated with CDCR healthcare, and they get to decide if and when individual prisons can come back under CDCR control. So prison healthcare today, this is true across the country and definitely in California, is offered in a variety of ways, operates both inside and outside of prison. So there's healthcare providers who are full-time employees of the prisons. There's physicians, nurses, physician assistants, pharmacists, et cetera, who work and provide healthcare inside of prisons. There's also specialists who come in either virtually or in person, obviously in the pandemic, more and more virtually. So they might come in on a semi-regular basis. There's a dermatologist who comes in once every however often to provide care. Individuals also receive care outside of the prisons. So many of you who provide healthcare may have provided care for people who are incarcerated. Things like births, surgeries, oncology care often take place in hospitals outside of prisons. And then in places like California, we have specialized medical facilities. So because we're so large, our prison system is so humongous, we have things like skilled nursing facilities and other types of institutions that are a part of the prison but can offer more advanced care. So turning back to Estelle v. Gamble, I wanted to focus on this just for a second. The key aspect of Estelle v. Gamble is this idea of deliberate indifference to serious medical needs. Noting that this deliberate indifference is consisted of unnecessary and wanton affliction of pain, which is not allowed under the 8th Amendment. And Estelle v. Gamble basically said that whether it's prison doctors or prison guards, anyone denying or delaying access to care or interfering with care is not allowed. And, I'm not a legal scholar, but I think that this idea of deliberate indifference is a little bit tricky to establish, whether or not there is deliberate indifference. It's not something like you need to provide X number of doctor's visits, right? It's a little bit more vague. And I wanted to provide 2 examples of the ways that this comes up to think about the healthcare that's being provided inside. So COVID-19 pandemic, I'm sure many of you are familiar with sort of the massive outbreaks that happened inside California state prisons. So this is just showing the current numbers, 49,000 people living in California prisons were diagnosed with COVID. That's more than half the population. You can see the comparison between the rates in the population in the US and California versus CDCR. So pretty astronomical. Luckily, this is now slowed down due in part to how many people have been were diagnosed with COVID over this time period. They've also, CDCR has been really prioritizing vaccinations. More than 2/3 of people who are incarcerated have been vaccinated. About 40% of staff are fully vaccinated. I'm hoping that those numbers keep going up. But there were so many people who were at huge risks during the pandemic. And during this time, there were efforts there was calls for and promises of and efforts to release people due to COVID. But this came out in the I think in the Chronicle in December, looking at how many people were actually released under sort of COVID programs, and we can see that 91% of those people who were released at this time, it was about 7,500 people, were people who were just released a little bit early. So they were scheduled to get out in the next 6 months, and their date was moved up a little bit. But CDCR had said, or the governor Newsom had said, we're going to prioritize people who are high risk medical, low risk, and low public safety risk. They put together a cohort of those people, identified them, but very few were actually considered for release. And really, the number who were released were very small, a teeny tiny proportion of the people who were released overall. And what that means is if we look at who actually ended up being released, if we look at the ages and compare it to the age distribution in CDCR, these charts actually look really similar. You know, the people who were released were not necessarily the people who were older. So the people who were 60 and older were actually much less likely to be released compared to their proportion of folks who are incarcerated. And this is for a few reasons, right? The people who are older, most of them have been there for decades. Very few people commit a very serious crime when they're 80, right? Most people who are older have been in for a long time. And this means they might not have determinate sentences. They don't have a date coming up when they're supposed to get out. Their crime may be one that's labeled as violent, which can reduce their risk. And so it means that, you know, because of this, the most vulnerable people weren't even really considered for being released during the pandemic. The most famous case that many of us heard about was what happened in San Quentin. And so just to give a little history, there were sort of no cases going on. And then, you know, at the end of May, early June, there was a transfer of folks from another facility, another prison in Chino that had an outbreak. Proper testing wasn't done. They were brought into San Quentin. Also around this time, doctors from UCSF and UC Berkeley came in, did a tour, basically said you have to release 50% of your population or you're going to be in huge trouble, you're going to have a huge outbreak. This didn't happen, and it turned out that 2,200 people ended up being infected with COVID very rapidly. This is out of about 3,000 people who lived in the prison, so quite stark. And this is currently being debated, right? Or not debated. This is currently being heard in a court hearing that the proceedings have been going on this week to see, you know, was there deliberate indifference? Did CDCR fail to protect people? So I think the pandemic has raised new questions about the boundaries of healthcare and the responsibilities of prisons to try to keep people safe, which I think, as Zach really spoke to so well, is not the design of prisons and has not been the role that prisons have played in our society. They haven't been keeping us safe, and that sort of goes doubly true for people who are living inside of them. The other example of deliberate indifference I wanted to think about and just touch on really briefly, I've been doing research for the last couple of years, interviewing people who've been incarcerated and hearing a lot about their experiences with medical care. And often the things that people tell me are things like, you know, people don't care about you. They don't feel like you deserve to get care. If you walk somewhere when you have shackles on, you're going to get the minimum. You're not a priority. And several stories of people, you know, being told there's nothing wrong with you. This is someone witnessing someone sort of being kicked and saying, get up. And, you know, she turned out her appendix ruptured after that. Someone else who saying they couldn't walk. They were told nothing's wrong with you. And she's like, really? I peed on myself. Clearly something's wrong. So many patients who are receiving their care in CDCR feel really strongly that there is sort of this deliberate indifference towards them. And when I speak with people, overall, they feel like CDCR is an institution, as well as individual providers and correctional officers don't care about them. And that perception, you know, is problematic. It means that there's people who don't seek out care when they're sick because they don't feel like anything's going to be done about it. And there's a perception that people are dying who don't need to. And this is, you know, so this is really troubling to me, that this is what the care that people report receiving and their perceptions of the care. However, I also want to note that, like, there are interesting research out there on the ways that prison healthcare can be a tool to do good. So my research is focused on people's experiences. In all contexts, when you interview people, you sort of hear the highs and the lows. You don't hear that much about the routine care. But, you know, people have noted that in many ways, prison healthcare serves as a vital safety net in our society. So there's many people who don't have access to care other places, and incarceration is what presents an opportunity for them to get care for the first time. People with chronic conditions are very likely to have them diagnosed and to get care when they're inside. California has had a really great success with HIV and making sure that everyone who's incarcerated, or a large proportion of people who are incarcerated, are finding out their HIV status, are getting on therapies, and are having low or undetectable viral loads. And that's all, you know, really fantastic. It's great. There's many healthcare providers who are incredibly dedicated, who work so hard to provide care for their patients inside our prisons and jails. And, you know, they want to serve their patients well. However, and it's a really big however, or two really big howevers, one thing important to think about this is that these gains do not extend beyond the prison walls. So even if people are finding out that they have diseases and getting treatment to manage chronic conditions inside, which is something that happens in certain circumstances, once you're released, your health status rapidly declines and your mortality rate rapidly increases. So the likelihood of you dying a year after you've been incarcerated is tremendously higher than those who never have been. So any healthcare advances that happen because you can get care go away immediately. The other big, however, is that we shouldn't see any increase in health status during incarceration as an endorsement of prison healthcare, right? We should be seeing it as an indictment of our community healthcare infrastructure. One should not have to be incarcerated to have access to healthcare, which unfortunately is part of the system we've created. And so that's the first sort of big question I'm raising is, have we created a society in which we're dependent on carceral healthcare? Sort of an oft-cited statistic is this one that the 3 largest mental health care centers in the country are LA County Jail, Cook County Jail in Chicago, and Rikers Island in New York. There's really complicated and important reasons, sort of both why this happened and how and why it's perpetuated. I'm not going to go into that, but I do want to point to some really great books that talk about this right now, which I think are also going to end up in the chat. But I did just want to note, I've been writing a paper now based on interviews we did with key stakeholders in San Francisco to understand the decarceration that occurred in San Francisco around the pandemic. And we talked to folks in the DA's office, public defenders, judges, sheriffs, community health workers, prison health or jail health care workers, advocates, so across the board. And what we're really hearing is that the sudden decarceration, the lowering of the jail census was really complicated. It's not easy to decide one day to be less reliant on prisons and jails when so many of our key services, including healthcare, are really tied and dependent on engagement in the criminal legal system. So we've set up a system where in order to get many services, you either have to be arrested, you have to go to a diversion program like a drug court, that's a way to get treatment, or incarceration itself, where you can sort of have you are able to recover or get vital emergency medical services. And that's really problematic. It's one of the forms of work that prisons are now doing in our society. And the other notes I wanted to do is just quickly some of the other forms of work they're doing. So Ruth Wilson Gilmore talks about the way that prisons have become so embedded in our economy. They go in rural areas and become sort of, they offer jobs and opportunity and economic stability to places. These are all places where people don't usually go. Most prisons we don't see on a regular basis. We don't really know what goes on behind them. And Angela Davis sort of asked the question of why do people tend to make, why do persons tend to make, sorry, this quote is weird. What makes people think that their own rights and liberties are more secure than they would be if prisons did not exist? So we have this idea, there are these prisons that are created. They help our economy, local economies in some way, or that's the promise. I don't really think that's true. And we're taught that we're safer because they're there, which, as Zach so beautifully illustrated, is just not the case. And so we think about people who are incarcerated, we other them, we call them inmates and prisoners and criminals and convicts, right? These are bad people who are different from us. We don't use words like patient or resident or loved one or child in both the I have a parent sense and a literal sense of children. We don't think of them as being members of our community, all of which means that poor healthcare inside becomes acceptable, right? These are bad people. I don't see what's going on. I don't know what's happening with it. And especially in something like healthcare, it's really easy to think, I don't have access to healthcare. I can't go and get healthcare. Why does somebody else have a right to that if I don't? Why should their healthcare be better when they're a bad person and I can't access it on the outside? So that's a huge problem, right? And it also drives a need to reform prison healthcare. That's something that many of us want. We want people who are inside to have access to quality healthcare, to be safe during a pandemic. But I worry about sort of a reform mindset when it comes to prison healthcare. So I think even those of us who are extremely progressive, who want to see social reforms, we often have this discussion where we're against mass incarceration. That's the discussion, mass incarceration, not against incarceration, period, right? We're against the death penalty, but we don't think about life without parole. We're against police brutality, but until recently, how many people were actually sort of talking about defunding the police? That's now on the table, which has been really interesting to sort of follow how that's shifted. We talk about nonviolent offenders, low-level drug offenders, without sort of noting that these are arbitrary categories and noting that really everyone who's incarcerated, almost everyone, they themselves have been victims of violence, and that's not something we center in this discourse. And so really we sort of center on reform instead of moving to an abolition mindset. And Angela Davis again says, frameworks that rely exclusively on reforms help produce the stultifying idea that nothing lies beyond the prison. We're so stuck in this idea of how can we change the system to be better, we can't fully imagine another possibility. This is so ingrained in our society. And so what I just want to sort of weigh out is sort of on the one hand, we need to reform prison healthcare. We need to make sure that people inside prisons are safe. If there's a pandemic, that we don't have as many people vulnerable. We need to make sure that people have access to quality care, can make good decisions about them, make decisions for themselves, have access to the treatment that they need. But by doing that, by reforming, we're investing more money into prisons. We're expanding the work that prisons do in our society, right? We're opening up new possibilities for the healthcare that can be offered, which then further entrenches the need for prisons, right? The more prisons do, the more we need them to exist to continue to serve those functions, which means we need to invest more prisons. So what do? How do we make prisons better for people who live there now, without reinvesting in a broken system that's harming our whole community? And so I just wanted to just end by thinking about this a little bit more. I don't know the answer to this question, and that's why I wanted to bring it here and think about it more. But I want to end just thinking, what is the role sort of for us, for physicians, healthcare providers, public health professionals, people who care about this? How might we be complicit in our actions in expanding the carceral state? Are there any alternatives? What could it look like? And I think one thing that I think about often, I recently heard some work by a scholar, Dana Stanley, who talked about a case of, she was doing an ethnography of a prison hospice, and she described someone who was hoping when they were in jail, they'd be sent to prison so they could get good health care for their end of life. And that's heartbreaking, right? No one should be reliant on prison to get good health care. But I also think we have to remember that we've created this world now where, can someone at the end of life get good care if they're released? If you've been in prison for 40 years, you get out, you get a couple $100 in a bus ticket. If you have dementia, where do you go? So the more we create things like hospices, like skilled nursing facilities, does it mean that we're creating this world and this idea where people who are sick at end of life either could be or should be incarcerated? And how do we move beyond that? So I think if we look to the pandemic for inspiration, if we think about the implications of the pandemic for health and illness, we see that, it's just not possible to keep people safe in prisons. They were not built for health and healing in mind. The only way for us to really serve people who are better is to incarcerate fewer people. But I think we have to think about how do we fight for both? How do we make sure care is better for people who are there now, while we fight to have fewer and fewer and fewer people behind bars? I will stop there.
Thank you so much, Jen. And thank you, Zach. So much to think about. And now we will move to a Q&A that will be facilitated by Jeff Ritterman and Aude Bognon.
Jeff,
I'm
you're muted.
wondering, Julie, if you have any questions from the chat before Aude and I jump in and ask our own questions.
Not yet, so please jump in. And everyone, also, I should reiterate, please buy Zach's book from Marcus Bookstore. It is the oldest Black-owned independent bookstore, I think, in the country. And they're in the chat. I'm going to post it again, but it's a fantastic book, and all the proceeds go to the Ella Baker Center. And also, if you feel comfortable, please turn on your video, raise your hand. We really want to see each other now and try to build community. So thank you.
So I'm wondering, Jen, if there's any possibility that, like, the VA system for healthcare could serve as a model for post-incarceration healthcare, because that's a government-run program. It's very successful for veterans. It's all over the country nationally. And I'm wondering if there's anything like that we could look toward to set up so those who leave prison could have options for health care that would provide for them long term.
Sure. And and I should note in many places, including in San Francisco and the Bay Area, there are transitions clinics. There are many services that people try to do to help connect folks with their services, both broadly in terms of access to things like housing, but specifically making sure you have your medicines, you can get a doctor. So there is a patchwork system there to try to support people. I mean, I think something like the VA should be expanded to everyone, not just people who got out of prisons, right? I think a single payer nationalized healthcare, is what we need so that people have this before they're incarcerated. Ideally, they're not incarcerated, and after. Because I think I would assume that most people would not support a specialized program just for people who've been incarcerated when, again, like they themselves may not have access to that same level of healthcare.
I noticed that you had the book Medical Apartheid on one of your early slides. And I wonder if you might share some of the prison stories in there of the kinds of research that was done. I'm thinking particularly of Holmesburg and Acres of Skin and the kinds of research that went on there. I wonder for our audience if you might share some of what went on within prisons.
Sure. Yeah, and I definitely recommend both of those books, and I can't do them justice, but it's fascinating and heartbreaking to sort of look back at the history, and I think that there is an interesting mix of sort of voluntary and not voluntary, whatever voluntary means in the prison context of experimentation. So I think, as someone who's a researcher who wants to do research with people who are incarcerated, I think a lot about what that has looked like over the years, and sort of research done by medical folks, academic folks, by pharmaceutical companies, by businesses, because there were many people. I mean, this was in certain prisons. I'm thinking specifically of the prison in Pennsylvania, which name I can't remember, that, this was a
Holmesburg.
source. Yes, Holmesburg, thank you, which was a source of income for folks, right? Like this was a way you could make money, is agreeing to be tested for all these things. And what I think is interesting is the way that sort of like the way I'm just really interested in medical research participation, who's allowed to participate, who's given opportunities in what context. And I think even though that does not happen, I was muted, but no. Can I keep talking? Does somebody want me to stop talking? No?
Yeah.
Okay. Anyway, I was just going to note that, we still have sort of really parallel systems. And when we think about participation in research, we often talk about needing to diversify our clinical trials, which is incredibly true. But Jill Fisher is a researcher who's talked about, for most phase 1 clinical trials in our country, Black and Hispanic men are who still participates. We still have sort of a group of people who participate out of desperation and need for income. And so it's shifted where that happens. But I think that, and I think Harriet Washington's book really outlines really well that Black and brown bodies have been the site of medical experimentation and of research for centuries now. And while that shifted in what it looks like, in many ways it really hasn't changed. And I think it's a fascinating, important topic to think about in more depth.
And one question for Zach. So for our listening audience, do you have suggestions on how people can be helpful in your efforts?
Yeah, I really appreciate that question, and thank you, Jen, for all of your insights. We're currently working on Bill SB 300, which would give folks an opportunity to come home. There are many folks, and this particular bill looks at the felony murder rule, which, for folks who aren't familiar, you could be involved in a crime, but not actually be the person who's responsible for killing someone. And in some cases, even when the police have killed someone else who's involved in the crime, you can be held responsible for it. And so we have a bill that would give folks an opportunity to be paroled. And as Jen was saying, like the folks who we have been working with in San Quentin and in prisons across the state of California are serving extremely long sentences, and sentences that are twice the international average and have not been shown to make any of us more safe. And so we've been working with currently incarcerated folks around identifying what are some of the bills that many of whom are duplicative of laws like 3 strikes. So we're adding sentences and time on people's sentences for things that are actually repetitive of the sort of core charge. Were effectively, competing with one another over who could have the longest sentences, not just in the context of drugs, but in the context of crime, period. And so one thing that folks do is, become a member of the Ella Baker Center. You can join us as we do prison mail night monthly. We're connecting with people who are currently incarcerated, and not just connecting, but building with and creating a virtuous cycle of the development of policy, the implementation of the policy, bringing people home. And we have members and staff who have been involved in that policy development and implementation. We're now in contact with over 7,000 people across the state of California, and it wouldn't be possible but for volunteers who are doing that work. So that is one really, I think, concrete way that people can get involved and engaged.
Thank you. We do have 2 questions in the chat. One from Desiree. Is a self-control program a form of healthcare? And Desiree, if you're here, feel free to speak up. Jen or Zach, does that?
I'm not sure I know what that means. It
Yeah.
looks like maybe Desiree signed off.
Okay.
Sorry,
well,
I didn't actually hear the question.
Is a self-control program a form of healthcare? I believe maybe it's a program to help people learn self-control. Maybe. Well, we can move on to Dr. Gold has a question. He says in the chat, thank you so much for both speakers. Or Bob, do you want to ask this yourself? I'm happy to do it. Okay.
Sure,
You're
Julie,
here.
thank you.
Okay.
And again, I really want to thank everyone for just incredible presentations. I had a question for both of you, which is regarding the location of children being also a problem of poverty in our country, where 140 million people are impoverished, according to work that's been done by the Poor People's Campaign. And just on Friday, both Representatives Lee and Priapal introduced this omnibus resolution in association with the Poor People's Campaign, which is talked about. Part of it is to connect the issues of incarceration with poverty, but it also weaves together a fundamental program to deal with all the levels of things that we need to do in terms of PSR's work, embracing, tying together the issues we work on in terms of the anti-militarist agenda, our work on nuclear weapons, connecting that with all the money that's going to policing. I mean, the different levels in that way of carceral states that are operating around the globe. And I wonder if either of you have any comments about that. I did provide the link to the third Reconstruction resolution in the chat. And again, thank you for both your talks.
Yeah. Jen, do you mind if I I really resonate with that comment, and it reminds me of something that I heard Dr. Barber say, was that we have in this country what he calls the death measures on the DL, or death measures on the down low, right? And so when he was naming and talking about police violence and state violence, he was really naming it as kind of the tip of the iceberg in terms of a larger system of governance that is actually causing death. And so that is part of what I meant and maybe didn't articulate as well as I could have in terms of like this ideology of the only good government is a death government, because as we were increasing the funding for policing and prisons, what we weren't increasing funding for was healthcare and education and the things that actually keep communities safe. And so, you know, he names that like for every 500,000 people who don't have healthcare, I think 2,800 people will die, and other similarly grim statistics that I think point to the need, as you're saying, to really have a third Reconstruction, with Reconstruction being the first and the civil rights movement and Black freedom movements being seen as the second Reconstruction, and the need to actually advance a third Reconstruction that would overcome, you know, some of the hurdles that he has named. Michelle Alexander in the New Jim Crow talks about the rebirth of caste and the way in which the caste system in the United States has been recreated through incarceration in the carceral state. And so I absolutely think that makes 100% sense, and am very supportive of that work.
And Rohini, are you still here? We noticed you had your hand up. Great.
Hi. Thank you both so much. I've learned a lot today, and Jen, your explanation of the legal framework was like the most clear thing I've ever seen on this, it's super confusing. My question was for Mr. Norris, actually, because I found it really fascinating what you're working on and what you're doing. I'm an ER doctor, but I teach at Cal, and more my students are like promoting just like more and more decarceration. And I find that I work at the Human Rights Center there, and like my generation and older, like we can't wrap our heads quite around what that means, especially for like the super bad guys. And I would love to have a better answer when I hear that, and maybe you can help me like understand what to say, because I'm with you, but like I don't have a good like explanation of how it would work. Like I don't have a vision for how decarceration, what that would look like, you know?
Yeah. And I think this is also a question for Jen, for sure. So I will try to be brief to make sure to give you space to talk. I feel like I'm a belated convert to abolition. And I spent, 20 years doing this work, and only recently identified as a prison abolitionist. And so I feel like I can speak as someone who's kind of been converted over time. And part of the journey for me has just been, understanding that the things that we do actually don't decrease harm. They actually repeat cycles of violence, harm, and incarceration. And I've seen that restorative and transformative approaches, including in cases of violence, actually work. I think the other thing to name is just for me that, it's not an overnight switch. Just as in the context of the climate movement, you can't just go from being almost entirely dependent on fossil fuels to a different energy infrastructure that is renewable and regenerative. In the same way, we're not going to just overnight move away from policing and prisons as being sort of seen as foundational to our safety. But what I have seen is that a public health approach absolutely works, even in cases where folks have committed serious harms. So I would point you to the work of Common Justice in Brooklyn and the work that they're doing, really showing that, as Jen said, that people don't come to violence just spontaneously, that there are typically folks have been survivors themselves of violence. And they're doing really incredible work to kind of interrupt those cycles and use a restorative justice approach. Even more locally, one of the examples I talk about in the book is Richmond, California, which used a kind of fellowship program, a violence prevention approach to deal with the 30 folks that the Richmond Police Department believed were responsible for over 70% of the homicides in the city of Richmond around 2004, 2005. And through a program of supporting these young men, providing them with a monthly stipend, providing them with mentorship, and providing them with travel opportunities, they were able to actually really shift these folks' perspective and engage them in participants in building safety, rather than continuing to kind of scapegoat them and identify them as being the problem. And so over a near decade-long campaign or just initiative, they were successful in reducing the homicide rate in Richmond by about 70%. And I think it's violence prevention programs like that that actually see people who are caught in cycles of harm and violence as being part of the solution that can actually work. And I'm excited because I think there is some money in one of the upcoming federal packages to support more violence prevention programs being run by folks like Devone Bogan and Pastor Mike McBride, among others. So yeah, I don't think it's an easy conversation, but I think it's one that we absolutely have to engage in.
Yeah, I agree with everything that Zach said, and I was going to use the fossil fuel example too, but I'll just say, I mean, I think it was the first thing that came to my mind, which is if you say like tomorrow we are banning all fossil fuels, like that will not work. That is a fundamentally, like, our society would grind to a halt. We couldn't do it. But many of us endorse, let's have a goal that in X number of years, we will no longer have fossil fuels or we will drastically reduce. And you can imagine a possibility for how we could get there. And I think if you look back, if you imagined, 20 or 30 years ago that X percentage of our cars could be electric, could run without gasoline, people would have said, no way, that's the future, that could never happen. And like, we're here. And I think what's so tricky about abolition is it requires such an imagining. It requires a total shift in how we think about our society. And I have a 4-year-old. She goes to preschool, she comes home and she's like, oh, like, you're a bad guy, let's play bad guys. Like, this idea that there are good guys and bad guys is ingrained to us from childhood. And I have to be like, there's no such thing as bad guys. They don't exist. There's people who make bad decisions. And I like make her say it back to me. Like, there's people who have bad circumstances, because we just think that there's certain people who are evil or bad. And so even those of us who think, of course, we shouldn't have, nobody thinks people should be in prison for marijuana anymore. But, there are some people who are just bad. And I think for me, so much of it comes from like being in community, talking to people who are those bad people. When you spend time with and you're like, oh, this is someone who's been to prison for murder, like, this is one of the bad people. And look, they're doing this beautiful work in their community. They're teaching me, they're teaching others. Is our world better when they're not a part of it? And to me, I can see that person and say no. But what is so tricky to me is when we talk about abolition, if we think about prison abolition in isolation, if we think the answer is no prisons, that's going to happen on this state, that will of course fail. If tomorrow we just said no more prisons, no more police, opened everything up, it would of course be a disaster, because we have to do everything together. We have to imagine a whole new world where education looks different, where healthcare looks different, where housing looks different, where jobs look different, where our systems of accountability to each other look different. And we haven't done that work yet. So I am very much an abolitionist, but I'm probably not an abolitionist tomorrow. I just don't think, we have to imagine a new world, and that takes so many of us coming together to do it.
And can I just add one quick thing? It's not a abstract question only, right? When we fought to close youth prisons and were successful, we also saw youth crime decline as we were closing youth prisons. And so there's this reality that, a win for human rights is actually a win for public safety. And I think we so often lose that thread. And we have been successful in closing state-run youth prisons, and now 58 counties around the state have the opportunity to either repeat the same thing that the state has done in investing in these remote youth prisons that actually do more to move young people into adult prison than anything else, or we could do something different and try to move over time towards a zero youth incarceration model. And I think that Alameda County could do that. I think that counties across the state could do that. They could say, we are actually, and this is what we're talking about with Alameda County. We're saying, let's close down your youth jail, which is based on an adult incarceration model, can house up to 360 kids. You have this other thing called Camp Sweeney, which is a little bit better, but is still, fundamentally about locking young people up. Let's actually use that as an interim place where we could over time begin to shift young people out of youth incarceration as a whole. And guess what? Like the young people who are in the youth system are not so fundamentally different than the people who are in the adult system, right? It's like 3 years difference, right? As Jen was talking about, it's often people who are very young, but they're over 18. And so they get tried as adults and they're spending decades upon decades. And so I think we have this sense of like, that the sky will fall if we treat people well. And I just don't think it's the case. I think like we can treat people with humanity, and we can increasingly decrease our reliance on things that look like putting people in cages, right? Because that doesn't work for health care, doesn't work for mental health. And ultimately, I think we have an opportunity to do better.
Great. Are there any more questions? We have a couple more minutes. Lots
I have one.
Oh, yes. Oh,
Yeah, it's kind of a broad question, but thank you both for your talks, and like it's really inspiring. Yeah, and so in my views, structural racism, oppression, and inequality are deeply endemic to our societal fabrics, and the devastations we've seen with the pandemic have just like, highlighted the results of like our failure to invest in robust public health systems and social security systems. And so I'm just curious, as people that have been carrying and looking these ideas for decades, there's obviously been a resurgence in this particular moment in history. What do you think is possible now that you didn't think was possible a year ago? And is there any narratives or visions that you'd like to uplift?
Jen, would you like me to go first?
Go for it. If you have
Okay.
thoughts, please.
Look, when I started this work, it felt literally like holding a match to a tidal wave. Like we were fighting all of the worst ideologies around youth of color and youth super predators, and the media was terrible and legislators were buying it, and we literally just said, okay, we're going to try. And I think that what I've found is that we can be successful. I would not have thought we would be having the conversations that we are today, but I think it is as a result of extremely dedicated folks, many of whom Jen named, from Angela Davis to Ruthie Wilson Gilmore to others who have really held out, Mariam Kaba, who have held out a vision of what's possible. And really stuck to it, and I think drug a lot of us along the way in ways that aren't about dragging, but are also are about inspiring and showing a vision of what's possible. And so, I am hopeful in this moment, because for me, the defund question isn't just about allocating resources, it's also about rebuilding democracy. And that's something that Jeff mentioned in the introduction, but I want to lift up, is like, we are in a post-Obama age. We are in an age where I think the limitations of representative governance in the confines of the United States Constitution have been laid bare. And so people are seeking ways to have much more direct say-so over how resources are spent. So I'm echoing a little bit, but to me, that's really inspiring, is to figure out not just how do we kind of tinker around the edges, but how do we change the rules of the game, period.
Thank you. Any more questions?
Can I just respond to that as well? Can I just raise one thing?
Oh yeah, I'm sorry. Yeah, of course.
No worries. I just wanted to know, I mean, it's such a hard question. I feel like the last year has been so hard. And so I'm grateful for the question to think about what I'm inspired more, because I think I've been like so held in all the things that have felt harder this year, all the trauma that it feels like we live out constantly on the internet over and over again. And you know, it's often felt like, are we making progress? You know, are things moving forward? You know, is our democracy going to exist? Like, you know, who knows what's happening here? But I think I just wanted to know that I think more of these conversations are happening all over. Like, I feel like, you know, I've only been researching in this area for a few years. And even when I started, I feel like it was very obscure. It was niche. Nobody was talking about it. People didn't get why I was doing it. People didn't care. And now I say it and people are like, oh yeah, that's important. Oh, interesting. I have thoughts on that. And often their thoughts aren't the same as mine. Their goals aren't the same as mine. But I think that there's more people in healthcare who are thinking about these issues, thinking about policing, thinking about incarceration, thinking about what that means. And I'm inspired by that. I'm inspired by like the number of students who are on this conversation who care about that. And so I think my big hope is that people stay interested and engaged in this topic. People want to keep doing work on it. People stay in these fields, in healthcare and in research, and wanting to advance this work in partnership with organizers, in partnership with impacted communities. And I think my worry is just, how do we make sure that we don't just move in an incrementalist way, and how do we sort of hold true? You know, when I walk around my neighborhood in San Francisco, like every window has a Black Lives Matter sign, right? Everybody has that, which is great. I'm glad it exists. But are people really in favor of these ideas? Are people in favor of abolition? Are they in favor of defunding? Are they in favor of sort of, you know, of radical change, of anti-racist policies? And so I think my big question is, how can we move people from noting that it's bad when police murder unarmed Black people, to it's bad when police kill anybody, to it's bad when police, you know, are invasive in people's lives and incarcerating people and taking away, and can we do the work to sort of connect the way that policing intersects with the welfare state, intersects with, you know, with our economy, with housing, you know, with all the work that Zach's doing? How do we make that conversation bigger? And I think that's like really what I'm hopeful for, that people are putting these pieces together more and thinking about more holistically, you know, how our whole society, our whole community is a part of answering these questions.
Just one comment. How do you see this work fitting into the question of reparations, which is, of course, a very unpopular idea in the United States right now? But I look a lot at the health gap, and it's hard for me to see how to close the health gap without also closing the wealth gap. And I know that Ode has been involved in I think it's called the Repair Project, which is also taking this on. And I wonder if you have any, and of course, a lot has been written about this. And I wonder if you have any thoughts about this question.
Sure, I'm happy to jump in. I agree. Reparations are not popular. It's a hot button issue. Something I put in the chat was a bill that's currently being considered that's offering reparations to people who were sterilized, including in the prisons, although it's not called reparations in the bill, but that's what it is, compensation for harms endured. And I agree completely that I think the wealth gap is a fundamental problem. Sorry if I'm pausing. I look like I am to me. Anyway, what I think, and this is also not popular as a thing, but if we talk about redistribution, but a redistribution of resources, and I think Zach speaks to this so well, but when I look at things like, if we think about the money that goes into the foster care system, the amount of funds that people get if they're taking care of kids in the foster care system, what happens if we put those funds and gave them to the parents in the first place to help them support their children? If we look at the funds we give, if we take the funds that we put to youth prisons and put them in youth, invest them in our youth, invest them in schools, invest them in our communities, what does that look like? If we take the money that we would be spending on policing in prisons, as Zach said, put it in books, if we're putting it in community, if we're putting it in jobs, if we're, developing, what does that look like? And to me, that's the similar work to reparations. So I guess my answer is yes, I'm in favor of reparations. I'm in favor of reinvesting in our community and taking things from punitive systems and reinvesting them in ways that offer support. I also would think it'd be great if we gave people direct checks, but I could be flexible on that since I know many people would be very against it.
Yeah, I mean, I think the connections are the ones that Jen named. I would just put a different accent on it. Like when I talk about, hey, we can have an entirely different system of justice for young people in Alameda County, you might think that we're talking about, lots and lots of young people. There are like 56 kids in the juvenile hall, and there's like 7 kids in Camp Sweeney, but maybe there's like more like 12 or 14 now. But they're spending like $500,000 per year per young person on those systems, right? And so some of it is about the money, but some of it is also just about the ideology, right? It's like, can we get past the idea that Black and brown people are just fit for punishment, that if we're going to invest resources, you talk to so many families who are like, oh, even Alameda County is doing some decent things by young people, like they're connecting them to apprenticeship programs with unions coming out of Camp Sweeney, and they're providing, some like gift cards for their families if they're struggling with certain things. But you talk to all of the families, they're like, well, where was this? Where was this before my child or grandchild was involved in the justice system? And so for me, like the connection between abolition and reparations is about this needed shift that we need to move away from, just move towards identifying all of us as part of the human family, right? And identify all of us as part of folks who deserve care and connection. And I think until we actually really grapple with the deep harms that we have caused communities of color, and that's part of the reason why I lifted up the history around Indigenous people here in this state. Like, I think until we start to really grapple with that, we are going to have a harder time in making the kinds of investments that we talk about. So I do think that, like, we have to be able to walk and chew gum and bring the historical analysis along with the vision of the future, because those things are intertwined in the right now.
Thank you. Thank you. Thank you. We are toward the end of our evening. So unless somebody has a question that is just burning, I'm going to hand it over to Ode to just say a few closing words. Thank you again, Zach and Jen.
Likewise, I feel like I'm just so filled and so inspired, and truly honored to be here tonight. I'm also very excited to see so many so many students here, some from like Future Black Lives, and really excited. These different groups are sort of coming together in conversation and community. I'll pass it off to Jeff to see if he has any last closing words. Yeah, I want to send my deep gratitude and love to both Jen and Zach. Thank you.
I just want to thank Tara Weeks, who is our behind the scenes technician and event producer, and also Sarah Abdulrahman, who is our fantastic intern and has been working behind the scenes to help us tonight. So thank you so much. Thank you, Jeff. Thank you, Ode, for hosting. Thank you, Zach and Jen, again. My heart is full. I have so much to read and think about, and I'm really grateful for all the resources. We will post all the resources on our website. So if we put a lot in the chat tonight, so feel free to check out the website in the next couple days if you miss something. And sign up for our newsletter and our events list so that you don't miss more of our great events. Here at SFBA PSR, we're trying to dive deeper and expand our knowledge and our vision in these important and complicated issues. Thank you, everyone. Good night.